Assembly Bill 1748 by Assemblymember Mays and Accolade the pupils.
Mr. Mays.
Thank you, Mr. Speaker. Members, in 2014, 4,500 Californians died of drug overdose, most related to opioids. And in Sacramento alone, 50 people have been treated for opioid overdose since March. This highlights the need to expand access to naloxone, a medication that can block the effects of opioids and stop overdoses. It is now available as an easy-to-use nasal spray. This bill allows schools on a voluntary basis to stock naloxone on their campuses and allows school nurses and other trained volunteer employees to administer it to someone suffering an overdose. This is a why not measure that will save lives. I respectfully ask for an aye vote.
Thank you, Mr. Mays. Seeing no discussion or debate on this item, clerk will open the roll. All members vote or desire to vote. All members vote or desire to vote. All members vote who desire to vote. Clerk will close the roll. Tally the vote. Ayes 68, noes 2. Measure passes. File item 65 passed and retained. File item 66 is AB 1937. The clerk will read.
Assembly Bill 1937 by Assemblymember Gomez and others and Accolade to electricity.
Mr. Gomez, you may open.
Mr. Speaker and members, Assembly Bill 1937 underscores the importance of environmental justice as a consideration of the state's energy procurement. This bill requires utilities to demonstrate that they have undertaken all feasible efforts to meet demand with cleaner, preferred resources that are cost-effective, feasible, and reliable. If the need to procure new gas-fired generation persists, AB 1937 requires utilities to give preference to resources that are not located in communities have borne the brunt of multiple pollution burdens for decades, to the extent feasible and not at the expense of reliability or cost to the ratepayer. Lastly, the bill clarifies existing law as it relates to eligible renewable resources to ensure that California moves forward towards a clean energy economy and our underserved communities are not left behind. I have worked with stakeholders to resolve almost all the issues and will continue to do so as the bill moves forward. This bill has been vetted by the Utilities and Commerce Committee as well as the Appropriations Committee. I ask for your aye vote.
Thank you, Ms. Gomez. Seeing no discussion or debate on the item, clerk will open the roll. All members vote or desire to vote. All members vote or desire to vote. All members vote or desire to vote. Clerk will close the roll. Tally the vote. Ayes 46, noes 25. Measure passes. File items 67 through 69 pass and retain. Moving to file item 70, AB 2115. Clerk will read.
Assembly Bill 2115 by Assemblymember Wood and Accolade to healthcare coverage.
Dr. Wood, you may open.
Thank you, Mr. Speaker and members. AB 2115 requires health plans to provide information about reduced cost drug assistance programs to those who are losing health care coverage. This notification would be part of the existing requirement to inform people about coverage that may be available to them under Covered California or Medi-Cal. While we in California have made great strides in expanding coverage, there are still gaps. People still fear out-of-pocket costs that occur from medical care and prescription drugs when coverage is lost. I've been working with the opponents and have taken amendments to address concerns that assure people no, these programs do not provide comprehensive coverage and that the objective source for this information is provided to consumers. I agree with the opponents that comprehensive coverage is ideal, but also know that for the recently unemployed, they often discover their income is too high for Medi-Cal and Covered California premiums without subsidies and may be uncomfortably high. I believe drug assistance plans can help people who may be in between jobs and without comprehensive coverage by making information about these programs available to them. I respectfully ask for an aye vote.
Ms. Waldron, you are recognized.
Thank you, Mr. Speaker and members. I rise in support of AB 2115. Helping individuals maintain access to medications is critical to control overall health costs. Interruptions and delays in getting access to medications result in 125,000 deaths per year and up to 69% of medication-related admissions to hospitals. This bill simply informs individuals about private and non-private coverage and help them access medications. AB 2115 is a good measure that received unanimous support in Health Committee, and I'm pleased to support Chairman Dr. Wood.
Thank you, Ms. Waldron. Seeing no additional discussion or debate, Dr. Wood, you may close if you wish.
Respectfully ask for your aye vote.
Clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote. Clerk will close the roll. Tally the vote. Aye is 67, no 0. Measure passes. Members, let's welcome a former member of this House, Steve Bradford, to the floor of the Assembly. Mr. Bradford. File item 71 is AB 2143. The clerk will read.
Assembly Bill 2143 by Assemblymember Irwin, an act relating to electronic recording.
Ms. Irwin, you may open.
I rise to present AB 2143, which will expand who is legally allowed to submit electronic records to county recorders. Current law establishes the Electronic Recording Delivery Act, which allows title organizations and financial institutions to electronically record certain legal documents with county recorders. These agencies must register with the Department of Justice and meet minimal liability requirements. AB 2143 will expand electronic recording to all entities that register with the Department of Justice and hold minimal liability insurance. It is time to expand this opportunity to all entities and bring California into the 21st century. I respectfully ask for your aye vote.
Thank you, Ms. Irwin. Seeing no discussion or debate on this item, clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote. Clerk will close the roll. Tally the vote. Aye 68, noes 1. Measure passes. File item 72, AB 2257. Clerk will read.
Assembly Bill 2257 by Assemblymember Mainshine and others, an act relating to local government.
Mr. Mainshine, you may open.
Thank you very much, Mr. Speaker. The Brown Act was passed by the legislature in 1953 to ensure transparency and openness in local governing meetings, but new technology has exposed areas of the Act that need to be updated. AB 2257 will update the Act by ensuring that meeting agendas are posted in a consistent, visible location on the homepage of the local agency's internet website or provide a direct link to an agenda portal. Transparency is what the Brown Act seeks to accomplish, but has difficulty doing so in the modern day due to new technology. AB 2257 updates this, and I'd respectfully request an aye vote.
Thank you, Mr. Mainshine. Seeing no discussion or debate on this item, clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote desire to vote. Clerk will close the roll. Tally the vote. Aye 68. No 0. Measure passes. File item 73, pass and retain. Moving to file item 74, AB 2346. Clerk will read.
Assembly Bill 2346 by Assemblymember Baker and others, an act relating to public social services.
Ms. Baker, you may open.
Thank you, Mr. Speaker and fellow members. I'm pleased to present you today AB 2346. This bill addresses the lack of accessibility of public social service position statements prior to human service hearings. Under current law, our constituents who are a recipient of public social services benefits can request a state hearing to contest an action taken by the county with regard to those benefits when they believe they are unjust or inappropriate. These programs include CalWorks, SSI, CalFresh, Medi-Cal, the California Assistance Program, and many others. The Department of Social Services annually holds about 100,000 of these types of hearings. These hearings often concern issues of denial of medical services for our constituents. Most of those hearings that happens in rural areas are conducted over the phone to save the Department of Social Services money by not requiring judges to travel to remote areas. However, our constituents who need to attend these hearings are not afforded a similar luxury. Claimants are required to go in person to their county Department of Social Services to get a copy of the county's position in the hearing. Additionally, the Department of Healthcare Services statements are only required to be available to our constituents just minutes before the hearing begins. Currently, the statement is not even allowed to be made available to the claimant online or via email. This inability to access hearing documents electronically imposes an additional burden on low-cost, low-income constituents, especially those living in rural and semi-rural areas. AB 2346 would make these public social service position statements available electronically and 2 working days before the hearing. This bill saves claimants both time and money by eliminating the need for them to travel in person just to get the position statement of the county. And making public social service statements like this electronically accessible modernizes and streamlines the processes of these hearings. I respectfully ask for your aye vote.
Thank you, Ms. Baker. Seeing no discussion or debate on this item, clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote. Clerk will close the roll. Tally the vote. Ayes 65, no 0. Measure passes. File item 75, passed and retained. File item 76, AB 2446. Clerk will read.
Assembly Bill 2446 by Assemblymember Gordon, an act relating to the State Water Resources Control Board.
Mr. Gordon, you may open.
Thank you, Mr. Speaker. Colleagues, unfortunately, some provisions of current law have resulted in state and regional water boards having to expend limited resources to defend against lawsuits brought without merit or for the purpose of delay. Most significantly, some dischargers have used the Water Code to impede or delay hearings on proposed pollution control actions. They go to court before the State Water Resources Board or Regional Board has actually taken an action. In the most egregious instance involving a perchlorate plume in Rialto, it took years of litigation before the Water Board could do its job. In response, AB 2446 would not prohibit a party from filing suit over an action taken by the water boards, but it would prevent suits to preemptively stop the Water Board from protecting our water. The bill would also make other changes to the law involving issuance of stays for an action taken by the State Water Board's own staff, aligning drinking water law with water quality law, and clarifying the showing of harm for actions brought on behalf of the people of the state of California. Concerns were raised on a prior version of this bill by water agencies, irrigation districts, and parties in agriculture. Recent amendments have addressed these concerns, and almost all of these parties have already submitted letters removing their opposition. I would respectfully ask for an aye vote.
Thank you, Mr. Gordon. Seeing no discussion or debate on this item, clerk will open the roll. All members vote who desire to vote. 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 Clerk will close the roll. Tally the vote. Ayes 44, noes 19. Measure passes. File item 77, AB 2551. Clerk will read.
Assembly Bill 2551 by Assemblymember Gallagher and others, an act relating to water.
Mr. Gallagher.
Thank you, Mr. Speaker. Members, we've seen how alternative delivery methods can help us in building infrastructure projects such as transportation. My bill, AB 2551, would apply this method to water storage projects. It's a bipartisan bill, and it would allow projects to utilize alternative delivery methods such as design, build, and construction management at risk instead of traditional methods, and will help expedite these projects and increase our water storage capacity. Benefits include higher quality work, cost certainty, and greater flexibility in awarding the contract. AB 2551 authorizes contracts to be awarded on a best value or lowest responsible bidder basis and lays out the process by which a local agency will solicit bids. It will also require a bidder to use a skilled and trained workforce in order to pre-qualify and ensure quality work. This bill is supported by the Sites Project, JPA, Northern California Water Association, State Building and Construction Trades Council, and the Valley Ag Coalition, and I ask for your support. Thank you.
Ms. Olson, you are recognized.
Thank you, Mr. Speaker and members. I, too, rise in support of AB 2551 as a joint author. The population of California has grown exponentially since the last time we built a major water infrastructure project in the state. And the fact of the matter is we cannot meet the needs of Californians in any region of the state without increasing our water supply. And as we all know, this need has become even more acute over the last few years due to severe drought. As my colleague and joint author has explained in full detail, AB 2551 would provide an important tool to help expedite the construction of long-awaited water storage projects. Members, we may not be able to undo the damage that has been done from this drought and prior droughts, but we can work now to prevent future damage to future generations. We have to make California worthy of investment now and in the future. We have to make sure we're doing everything we can to ensure an ample, long-term water supply for our state. I respectfully ask for your aye vote.
Thank you, Ms. Olson. Seeing no additional discussion or debate on this item, clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote. Clerk will close the roll. Tally the vote. Ayes 65, noes 1. Measure passes. File item 78, pass and retain. File item 79, also pass and retain. File item 80 is AB 2899. Clerk will read.
Assembly Bill 2899 by Assemblymember Roger Hernandez, an act relating to employment.
Mr. Hernandez, you may open.
Thank you, Mr. Speaker and members. Existing law requires an employer that appeals a wage claim to superior courts to first post with the bond for the amount of wages. This ensures that the money is available to the worker at the end of the process and prevents the appeal process from being used as a delay tactic to hide assets so the worker is able to collect. This bill would impose a similar bond requirement when an employer appeals to court a citation and a judgment issued by the Labor Commissioner. The protection of the wage bond should apply equally in both situations. There is no opposition to the bill. I respectfully ask for an aye vote.
Thank you, Mr. Hernandez. Seeing no discussion or debate on the item, clerk will open the roll. All members vote who wish to vote. 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 Clerk will close the roll. Tally the vote. Ayes 44, noes 23. Measure passes. We've dispensed with file item 81. File item 82, AB 2072. Clerk will read.
Assembly Bill 2072 by Assemblymember Chang and others, an act relating to high school diplomas.
Ms. Chang.
Thank you, Mr. Speaker. Today I rise to present to you AB 2072, which establishes a state seal of STEM for qualified high school students. AB 2072 will motivate and reward participation in STEM at a young age. The bill before you today is the product of extensive thought and work by myself and the Education Committee Chair, along with both of our offices. It has earned unanimous support in both the Education and Appropriations Committees. With that, I ask for your support.
Seeing no discussion or debate on this item, clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote. Clerk will close the roll. Tally the vote. Ayes 64, no 0. Measure passes. File item 83, pass and retain. We dispense with file item 84. Moving to file item 85, that's AB 2611. Clerk will read.
Assembly Bill 2611 by Assemblymember Lowe, an act relating to public records.
Mr. Lowe, you may open.
Thank you very much, Mr. Speaker and members. AB 2611 modernizes the California Public Records Act by adding new technologies to the act, such as body-worn cameras or in-car videos as it relates to the record of information. This bill also exempts two types of law enforcement records from disclosure to the public in response to a PRA request. As a brother of a police officer, I should never have to worry about such a video being open to the public. I respectfully ask for your aye vote.
Thank you, Mr. Lowe. Seeing no discussion or debate on this item, clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote. Clerk will close the roll. Tally the vote. Ayes 66, no 0. Measure passes. File item 86, AB 2430. Clerk will read.
Assembly Bill 2430 by Assemblymember Beth Gaines and Act relating to taxation.
Ms. Gaines, you may open.
Thank you, Mr. Speaker. Members, you've heard me talk about the epidemic of diabetes in California. You've also seen my continuing attempts to address this epidemic in an efficient and fiscally responsible manner. There continues to be disbelief about how serious this epidemic is, so I'll continue to work on highlighting how serious this issue has become and will continue to be. Today, as many as 1 in 3 Californians are diagnosed as diabetic. The total cost of treatment of diabetes in California has exceeded $29 billion. This dollar amount includes hospitalization, outpatient treatment, disability payments, loss of individual productivity, and more. Yet California only commits a paltry and meager 3 cents per capita to address diabetes. Recently, a lot of attention has been given to the study coming out of UCLA in March of 2016 on prediabetes, which generally could result in diagnosis of type 2 diabetes. However, little to no attention is given to type 1 diabetes, which used to be referred to as juvenile diabetes, given its high incidence in children. In California, there's an estimated 190,000 people diagnosed as type 1. While it certainly seems to be a small percentage compared to the 8 million plus of the diabetic population, the costs associated with type 1 diabetes are immensely disproportionate. Because type 1 diabetes is an autoimmune disease in which a person's pancreas stops producing insulin, type 1 diabetics must balance insulin doses either by injections multiple times a day or continuous infusion through a pump with eating and other activities throughout the day and night on a daily basis. They must also measure their blood glucose level by pricking their fingers for blood sometimes 10 times a day. These tools, the pump, the sharps, the blood glucose meters, the testing strips, they're not cheap, and as technology evolves, they get more expensive. AB 2430 seeks to create a voluntary tax contribution designation on a state income tax deduction form so taxpayers can directly donate to institutions like Juvenile Diabetes Research Foundation, JDRF, who is the leading global organization for funding for type 1 diabetic research. JDRF is the only global organization with a strategic plan to bring those living with type 1 diabetes a continuous flow of life-changing therapies and ultimately a cure for the disease.
Thank you, Ms. Gaines. Mr. Ridley Thomas, you're recognized.
Thank you, Mr. Speaker. I rise to ask that this body approve AB 2430 by the woman from El Dorado County, the gentlelady from El Dorado County. This creates a voluntary checkoff. The Revenue and Taxation Committee heard it, and as you all know, diabetes and juvenile diabetes is of great concern to many communities across the state, not the least of which includes the 54th Assembly District. With that, I would thank the gentlelady for her hard work and long suffering on the issue. We know that this bill arises from a personal story, and it has gotten the personal touch with respect to her advocacy and public policy. So we salute her for her work and would respectfully request that this body support AB 2430. Thank you, Mr. Speaker.
Thank you very much. Seeing no additional discussion or debate on the item, Ms. Gaines, you may close if you wish.
Thank you from my friend from Los Angeles County. And members, I respectfully ask for an aye vote.
Clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote. Clerk will close the roll. Tally the vote. Ayes 71, no 0. Measure passes. File item 87, pass and retain. File item 88, H.R. 50. The clerk will read.
House Resolution 50 by Assemblymember Medina relative to Lupus Awareness Month.
Mr. Medina.
Mr. Speaker and members, I rise to present H.R. 50, which recognizes May as Lupus Awareness Month. Lupus is a disease that affects more people than AIDS, cerebral palsy, sickle cell anemia, and multiple sclerosis combined. Lupus affects approximately 1.4 million Americans, including Maya Avila, late daughter of my colleagues Ruben and Lupe Avila. 90% of people diagnosed with the diseases are women. 80% develop it between the ages of 15 and 45, and it is 2 to 3 times more prevalent among people of color, including African Americans, Latinos, Asians, and Native Americans. There are at least 9 states that have declared May Lupus Awareness Month, and today I ask that we do the same so that awareness is made about lupus and hopefully one day a cure can be found. Members, I respectfully ask for your aye vote and request that the first roll be open for co-authors.
Thank you, Mr. Medina. See no discussion or debate on this item. Mr. O'Donnell's microphone is hiding. Mr. O'Donnell's microphone is now down. Seeing no additional, Mr. Wilk, put that microphone down. See no additional discussion or debate. Mr. Medina is asking that the first roll be open for co-authors. Clerk will open the roll. Members, this is for co-authors. Co-authors on the resolution. This is for co-authors, members. Clerk will close the roll. There are 73 co-authors added. Without objection, we may take a voice vote on the resolution. All those in favor say aye. Aye. Opposed say nay. The ayes have it. The resolution is adopted. Members, I'm prepared to lift the call on file item number 30. That's AB 1820. Clerk will post. All members vote who wish to vote. All members vote who wish to vote. All members vote who wish to vote. Clerk will close the roll, tally the vote. Ayes 43, noes 23. The measure passes. File items 89 and 90 pass to retain. File item 91, SJR 19. Clerk will read.
Senate Joint Resolution 19 by Senator Jackson and others relative to women's reproductive health.
Madam Speaker Emeritus, you may open.
Thank you, Mr. Speaker. Members, I'm pleased today to present SJR 19 on behalf of the Senator from Santa Barbara. SJR 19 reaffirms that the state of California stands in strong support of Roe v. Wade and the work of Planned Parenthood, both of which are essential to women's reproductive health. January 22, 2016 marked the anniversary of the United States Supreme Court's landmark decision in Roe v. Wade, which acknowledged the principle that every woman has a fundamental right to control her own reproductive decisions and is the cornerstone of women's strides towards equality in the last 4 decades. Recent reports have found that threats of harassment, intimidation, and violence against women's health clinics have doubled since 2010. As recently as November of last year, a Planned Parenthood clinic was the target of a heinous act of domestic terrorism, resulting in the deaths of 3 people and injuring 9 others. Also in the city of Thousand Oaks, another Planned Parenthood clinic was the target of arson. Hidden camera videos released last summer have prompted several investigations into alleged misconduct by Planned Parenthood. However, months later, a Texas grand jury convened with the purpose of investigating Planned Parenthood. And not only did the grand jury clear the organization of any misconduct, it went a step further and instead indicted 2 members of the group that actually made the videos. These insidious, illegal, and indeed criminal efforts to undermine women's access to health care simply must stop. Texas is the 12th state where investigations stemming from the videos have found no wrongdoing by Planned Parenthood. In fact, the Congressional House Oversight and Government Reform Committee's investigation also found no evidence of misconduct by Planned Parenthood. Nonetheless, several states are moving towards defunding the organization. These unconscionable efforts threaten to deprive the nation's young women, and frankly the poorest women, of health services that they so desperately need. 97% of what Planned Parenthood provides includes well woman examinations, birth control, testing and treatment of sexually transmitted infections and HIV, pregnancy tests, life-saving cancer screening, sex education, prenatal care, other life-saving primary care services, and yes, referrals for additional services. A sudden defunding of Planned Parenthood's health centers by federal or state governments would put California women at risk because Planned Parenthood is sometimes the only source of health care services. Just last week, the Oklahoma legislature passed a bill making it illegal for a doctor to perform an abortion. The bill's author said he hopes it leads to the overturning of Roe v. Wade, which underscores the need for us to continue to fight for this fundamental right. Members, that's why it's vital that we urge the President of the United States and members of Congress to support access to comprehensive reproductive health care, including the services provided by Planned Parenthood, uphold a woman's fundamental right to control her own reproductive decisions, and strongly oppose efforts to eliminate funding for Planned Parenthood. I urge an aye vote.
Thank you, Madam Speaker Emeritus. Seeing no discussion or debate on this item, would you like co-authors on the resolution? Madam Speaker Emeritus is asking for co-authors. Clerk will open the roll. Members, this is for co-authors on SJR 19. This is co-authors, members. Clerk will close the roll. There are 44 co-authors added. We will take a roll call vote on the SJR. Clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote. The clerk will close the roll, tally the vote. Ayes 47, noes 20. The resolution is adopted. Mr. Calderon, you are recognized for your motion.
Thank you, Mr. Speaker. At the request of the author, I am giving a one-day notice of intent to remove file item A19, SB 443 Mitchell from the inactive file.
The clerk will note. Items 93 through 94 pass and retain. The session schedule is as follows. Tuesday, May 24th, check-in session and floor session upon call of the Speaker. Wednesday, May 25, check-in session and floor session upon call of the Speaker. Thursday, May 26th, check-in session and floor session upon call of the Speaker. Friday, May 27th, floor session at 9 a.m. All other items remaining will be passed and retained. All motions shall be continued. Seeing and hearing no further business, I am ready to entertain a motion to adjourn. Mr. Gibson moves and Mr. Wilk seconds that this House stands adjourned until Friday, May 27th at 9 a.m. Quorum call is lifted.